On the COVID-19 front, our data continues to drastically improve. During the worst days of the winter surge, over 30% of our hospital census were COVID-19 patients, around 5,700 Georgians in the hospital. Today, that number is 1,523 patients, around 10% of our census. Our 7-day average of new cases is the lowest since early November, and our percent positive test is at its lowest level since October. And thankfully, we are now seeing deaths continue to decline. This data is very clear. Every metric on the COVID-19 pandemic is headed in the right direction. We have made significant progress without a statewide mask mandate. The people of Georgia did this without shutting down restaurants or bars or closing churches or houses of worship. Georgians stepped up and did the right thing. The people of our state are resilient, and they have proven that over the last year. And as we've said many times before, people, not the government, would stop this virus. Georgia has been open, and Georgia will continue to be open because we are a state that values both the lives and livelihoods of all our citizens. When it comes to vaccine distribution and administration, we continue to make significant progress in vaccinating our most vulnerable Georgians. With 77% of our COVID deaths occurring in those over the age of 65, we focused on providing access to the limited supply of the vaccine to these high-risk Georgians. That approach has led Georgia to beat the national average in vaccinating seniors, with nearly 2/3 of our total senior population receiving at least one dose. With increased supply on the horizon, we worked quickly with Georgia Emergency Management and Homeland Security Agency to stand up 4 initial mass vaccination sites, and announced last week that an additional 5 sites would go live a week from today. We also expanded vaccine criteria beginning this week in order to protect more high-risk Georgians and get our citizens back to normal. To ensure that we stay ahead of the increasing vaccine supply and any lagging demand among currently eligible Georgians, on March 15th, we will be expanding vaccination criteria further to include all Georgians over the age of 55 and those with high-risk conditions defined by the CDC. Dr. Toomey will cover these conditions during her update here in just a few minutes. But again, the criteria will open up on March 15th to Georgians over the age of 55 and those with high-risk conditions as defined by the CDC. Adding these additional high-risk Georgians will mean that vaccination will be available to categories that have accounted for 92% of our deaths due to COVID-19 in Georgia. As we have from the beginning, we will protect the most vulnerable to severe illness, hospitalization, or death, and enable Georgians to get back to normal. Provided we continue to see increasing vaccine supply, it is our intent to open up vaccination to all adults the first part of next month. For everyone currently eligible, I want to urge you to please make your appointment as soon as possible. The Department of Public Health's website has a vaccine provider locator tool, as well as a scheduling website for public health districts at dph.georgia.gov. You can also register for the soon-to-be 9 state-operated mass vaccination sites at myvaccinegeorgia.com. And with well over 2,000 private providers, including Kroger, Publix, Walmart, Ingles, Walgreens, CVS, and others, we will continue to encourage all eligible Georgians not to wait to get their dose. This vaccine, as we've said many times, it is safe, it's effective, and is our ticket back to normal. The more Georgians who choose to roll up their sleeve, the quicker we will get to that point. Over the weekend, following her second vaccine dose, I was able to give my mom a long-deserved, long overdue hug for the first time in over a year. It was a reminder of what we all have ahead of us as we continue to move through this process and get us back to a normal way of life. I am convinced that we will get there. I'm convinced that we're going to get there sooner rather than later if we continue to get shots in arms and if we continue to do all the things that have gotten us here over this past year. Thank you very much, and with that, I'll turn it over to Dr. Toomey for her update.
Thanks so much. It's really good to be here today to talk about the exciting things that are happening in the vaccination program, and that we are opening up to additional eligibility individuals, as the governor said, over age 55, but also those adults 16 up through adulthood who have multiple health conditions that may put them at risk for complications of COVID. And this is something that was very, very important, I think, for us to do, was we've taken an approach of trying to prevent as many deaths and as many hospitalizations as possible in the way we've rolled out this vaccine. Those individuals who have, although they may be younger, who do have these health conditions may end up with more complications from COVID. And I just wanted to go over some of these conditions so that you know the breadth of the eligibility that we're now going to be prioritizing in the vaccination program as we beginning next week. So asthma, particularly severe asthma, all cancer and those who are being treated for cancer, cerebrovascular disease, so that's that affects the blood vessels in your brain and the blood supply to the brain, so that you may you've had a stroke or some other neurologic problems, and neurological conditions such as ALS, chronic kidney disease, chronic obstructive pulmonary disease or other lung diseases, cystic fibrosis, multiple sclerosis, diabetes, hypertension or high blood pressure, and other heart conditions, including heart failure, coronary artery disease, cardiomyopathies. These are all things that affect the heart, but also can lead to complications from COVID. Immunocompromised states, so again, individuals with HIV, for example, will be eligible now. Liver disease, neurological conditions such as dementia, Alzheimer's, again, at higher risk for complications. Overweight and obesity, that is one of the greatest risk factors in childhood as well as adulthood for complications of COVID. Pulmonary fibrosis or lung scarring, which could be caused by any number of factors. Sickle cell disease, which affects a large number of people here in Georgia. And thalassemia, another type of blood disorder. So you see, it's very broad. The breadth of now eligibility has really grown considerably, and I think many Georgians 16 through adulthood now will be eligible, and I think that's a very positive development for us. I think that it will be very important to continue to reinforce the eligibility, but also to remind everyone that although Pfizer can be used for individuals 16 and 17, so those are both those with developmental disabilities as well as some of these other conditions, Pfizer is not available at every vaccination site. And so if you were trying, either a parent with a child who needs to be vaccinated, or you yourself need to be vaccinated, or vaccinate a family member of that age, it's important that you register ahead of time and look on our website, where we will list those sites that have exclusively the Pfizer vaccine or have it available, so you can be sure to get vaccinated with the right vaccine. And all of our sites that GEMA is currently operating exclusively use the Pfizer vaccine. I also wanted to just talk very briefly about the really important partnerships that we've been able to develop. We've been working with Walgreens to partner to be able to increase vaccination for people living with intellectual disabilities and their caregivers. And Walgreens has stepped up to the plate to be able to help us with these vaccinations, because many of these young people may feel uncomfortable in some of the other vaccination settings. And we're actually piloting over the next 2 weeks throughout Georgia to encourage these clients to go to a Walgreens site and to really have that special TLC for that vaccination program. We're going to have one open in Athens and a number of other special locations. We again will post these on our website so that you'll know. We are also, even as we're moving into these other categories, are continuing our partnership with the areas on aging and the aging advocates who are helping us with a remarkable number of individuals that we were not able to make an appointment or were not able to be transported without assistance to our sites. That will continue, and that partnership, which was only developed in the last several weeks because of the need to identify these individuals at risk and be able to transport them, has already paid remarkable dividends and will continue to do so as we think about moving in even on beyond COVID and for next year's flu season, for example. And in many cases, the AAAs had not even known the health directors and vice versa. And so now we have established a very effective collaboration throughout. This is all over the state, not just here in Atlanta, that will allow us to do our work better.